physician. I work here in Manchester, live in Bedford, and I've been in healthcare for 35 years. I agree with the mayor that this is a horrible bill. But I don't agree that we can tinker with health, just slightly tinker with healthcare. We have to fundamentally change the system. I think the only way we're going to fundamentally change the system is we, and to me the we is the providers and the patients take back the control. We keep talking about what the insurance companies are doing, what the insurance companies are doing. I'm not sure why we're expecting insurance companies to solve the problem. Insurance companies' only purpose is to collect money, hold the money for a while, pay it out. They don't provide health care, and they're just a processing mechanism. And so why do we expect them to come up with the benefits? I think there are things that we could do. I mean, New Hampshire, and one of the reasons I like being here, I used to live in Massachusetts for a couple of years, is we are big enough and small enough to actually do something different. And I think what we need to do, and we need to defeat the legislation and send people into Washington that actually allow us in the state to do what we want to do. And I think if we had, and there are coalitions that are forming already, if we had the patients and the providers getting together and formulating the plan, and then telling the financiers how we want this financed, that can be done. It's been done all over the country. Large employers, and we don't have that in New Hampshire. If you go to Boeing out in Washington, they don't care what the insurance company says. They negotiate health care for their employees. Then they find someone to process the claims. We need to take back that kind of control, because otherwise we can't afford it. This bill is so disastrous, and it's even much more than you're saying. Right now, if you have commercial health insurance in New Hampshire, 20% of what you pay covers what the government isn't paying for the people that they are supposedly covering. I mean, Medicare is a loss to everybody that provides care. Medicaid is such a ridiculous loss that any intelligent individual, if they were a business person, wouldn't see any Medicaid patients. We talk a lot about the uninsured. The subsidies for Medicare and Medicaid are far greater than the subsidies for the uninsured. So the problem doesn't get solved by giving uninsured, certainly giving uninsured federal insurance. The only thing that would do is increase everybody's premiums that are here. So we've got to really change the definition, but it's not tinkering. We have to fundamentally change the way it's financed. And I also say that, you know, as a physician, I want more money in the system. I actually think there's plenty of money in the system. I think there's a lot of places where there's significant waste. There are a lot of federal rules and regulations. There are a lot of people who have taken a lot of money out of this system and taken out of the provision of health care, which if we could capture that money back, we could provide more care to the patients and not increase costs.
Thank you, Dr. Harris, for being here and talking about this piece of legislation. I would agree, and again, that's why I talk about local control and the relationship between a physician and a patient. And that's exactly what you're talking about. A provider and a patient need to stand up together and talk about where is the best, what is that relationship, that bond is very, very critical when it comes to the future care and the future planning of your care. That is the entity that should be driving the discussion. But I don't believe we have a Congress who cares about that relationship. And this bill is that evidence. I also hear from physicians that defensive medicine practices is so costly, probably part of the ways that you're referring to, within the existing amount of money that is spent, that could be reduced, returned back to the consumer, and put back into your own personal health care plan in a far more productive way. These are the things that are not being addressed. And these are the things that I wish our representatives would hear when they try to bring the federal government in to fix a problem. And let's not get away from it. The federal government is trying to fix a problem, it really doesn't have any business fixing it. When you put if you put a provider, a physician, and a patient in a room to figure out what is the best solution, the two people who are most directly affected by legislation, I think you're going to come out with a far better solution than a bunch of people down in Washington who don't really have an appreciation for that relationship. I saw some other hands up over there. Yes, sir.
And I have yet to see any serious approach to tort reform in these bills. Maybe in the area of malpractice for the insurance. Certainly a person that has a malpractice suit should receive back their special damages and reasonable and fair punitive damages. But what's happening is people are getting punitive damages in the millions of dollars there. And some of those are probably fair, most of them seem exaggerated. In this particular case right now in New Hampshire, we've got the governor trying to get $122 million, I think, from the JUM malpractice fund that the doctors is paying. Now, I'm certain that that's a lot of money for the doctors to put in over the years, and that they would have more money to use in their practice and be realistic about it rather than storing $120 million that the governor's trying to, I was going to say steal, but extort is probably a nice little word there. But tort reform, like I said, why doesn't it pass? Because the ACLU is the biggest promoter and biggest depositor of money into Congress there, and also a lot of lawyers in Congress. So, like I said, we have to approach that, and we can do it easily. Texas has done that already. Right now, doctors are moving into Texas.
Yeah.
Because of that. They're moving out of other states, mainly like New York, and hopefully not from New Hampshire. Thank you.
The defensive medicine is fueled by the concern that physicians have about being sued, and and you have in both areas a lot of wasteful dollars. I mean, I think everybody believes that, God forbid, there's a legitimate something that happens to a patient, and there was clear fault there. Nobody disagrees that that individual should be compensated. I mean, we have a system in place that can allow that. But there are frivolous lawsuits that are filed that cost millions and millions and millions of dollars, and it puts physicians in a position to practice defensive medicine. They're not looking to practice defensive medicine, by the way. I talk to enough doctors who say, we don't want to do it, but we feel that we have to, which is more cost to the system, and they still get sued. And you're right, Texas, there are those who argue that the new law in Texas is not working. Well, you can't argue with this fact. There are more doctors that are moving into Texas now as a result of those caps being put in place. There is more access to care, and there are more physicians who are now moving into that state because they feel that they're being treated much more fairly than any other state in the country. So, to me, I'd like to see the healthcare industry thrive here in New Hampshire. It's one of the top industries in the state that produces not only quality health care, but it produces quality jobs. And we haven't even talked about what this health care bill does to jobs, but it is a job-killing piece of legislation. The White House economists say that this will kill jobs. This is not what the Republicans are saying. The White House economists say this about this piece of legislation. Now, you're not going to hear that much in mainstream media, but you will hear it from people like me who read the articles and see the positions and statements that their own individuals are saying. And we're having a tough enough time with the economy as it is.